Hello, I am Dr. Mangesh Kamath. I am a consultant hemato-oncologist and bone marrow transplant physician practicing at Helios Cancer and Hematology Clinics, Bengaluru. We are going to discuss a disease called lymphoma. Lymphoma is a disease very commonly seen by hemato-oncologists like me, but lymphoma is not one entity. There are multiple subtypes of lymphoma. It is not easy for us to basically call lymphoma as one type and treat it in one similar way. In fact, there are multiple subtypes of lymphoma which are treated in different ways and they may not have even similarity at all. So, lymphoma is broadly divided by the clinician into a slow lymphoma, that is indolent lymphoma, mildly aggressive lymphoma, and a rapidly aggressive lymphoma. The problem you encounter when you are treating with rapidly aggressive lymphoma is that if they are not treated immediately, they behave like blood cancer and the patient may die due to the lymphoma. The advantage of indolent lymphomas is that time is usually not the enemy, but it is very seldom possible to cure indolent lymphomas. And then you have the intermediate or mildly aggressive lymphoma. These lymphomas are probably more curable than indolent lymphomas, but less aggressive than the highly aggressive lymphomas. So you have a little bit of time, and even the patient comes to our clinic after having symptoms for a few months. So what is lymphoma? Lymphoma is the disease of the lymph nodes in our body. God has given us lymph nodes which are basically like security cells starting from head to toe of our body. Whenever there is any organ that is infected, such as, for example, if you have infection of your lungs by pneumonia, then the lymph nodes around the lungs will capture or prevent the infection from going out of the lungs into the bloodstream and then elsewhere. So, lymphoma is a collection of our immune cells which will work coherently to prevent the infection from a particular organ to becoming systemic or spreading all across the body. So, I told you clinically we look at indolent, mildly aggressive and highly aggressive lymphomas. We also have what is called as a immunophenotypic classification of lymphoma. So the white cells in our body are divided into the lymphocytes, okay, and then you have the granulocytes and monocytes. So lymphocytes are divided into B cells and T cells. So usually lymphomas is the disease of the B cells or the T cells. Sometimes you can also get some specialized lymphomas such as NK cell lymphoma and so on and so forth. That is not very commonly seen. Now B cell lymphoma are the commonest type of lymphoma. T cell lymphoma are less commoner than B cell lymphoma. And in B cell, again, as I told you, clinically, there are variants which are indolent, mildly aggressive and highly aggressive. Same goes with T cell lymphoma, though T cell lymphoma tend to be a lot more aggressive than B cell lymphoma in general. How do we treat the lymphomas? Well, if they are indolent lymphomas, we give low dose therapy, not a very aggressive therapy, and we make sure that the lymphoma is controlled for a long time so that the lymphoma does not cause symptoms to the patient. In the case of mildly aggressive lymphoma, we know that if it is not well treated, it can blow out into large proportion and can cause severe symptoms and also death for the patient. Hence, we increase the intensity of the therapy, make sure that the lymphoma is hit hard so that either cure or control can be achieved. When it comes to highly aggressive lymphoma, we have to treat it like how we treat leukemias or blood cancers. If we don't treat them in an aggressive manner, then the patient can succumb to the lymphoma. So in this case, we have used high dose chemotherapy, high dose targeted therapy to make sure that the lymphoma is treated well. Now, Is chemotherapy the only treatment for all the lymphomas? It is partially true. Sometimes we only use targeted therapy. We use certain monoclonal antibodies, which is classified as immunotherapy, which when combined with lower dose chemotherapy can give you the same benefit as probably using only chemotherapy. So by this strategy, we reduce the side effects but increase the effects. These targeted therapies will only attack the diseased lymphocytes, and hence the normal white blood cells in our body are not disturbed much. Whereas chemotherapy will tend to kill the cancer cells preferentially, but also can cause side effects to the individual. So this is the management of lymphomas in a nutshell. There are a lot of details. Your hemato-oncologist will guide you regarding this. And remember, whatever the type of lymphoma your friend or relative is suffering from, it is always important to treat cancer in the best way at the first attempt. Sometimes many of these lymphomas may not give you second chances. Patient may not survive.